Hi, this is Dr. Rukmani Choudhary and you are watching Dr. Rukmani's Health Update. My today's topic is Balanitis. So I'll be discussing all about Balanitis. What is the medical condition? What are the causes, risk factors, who are at the risk, sign or symptoms you have in Balanitis, or diagnostic criteria, required test, how we diagnose the problem, prevention part, how you can prevent this condition, very good effective homeopathy medicine, use allopathic mode of treatment, and last home remedies. You can treat this problem at home by using some home remedies. So you are requested to watch complete video for complete information. If you're watching for the first time, don't forget to subscribe my channel and press the bell icon. So let's begin. What is Balanitis? See, itis is the word that is used for the inflammation, means for the swelling, and Balanitis means inflammation, swelling of your part of your means of the glands. So this is inflammation of your glands in which you have redness, swelling, and at times it is very painful to touch, very sensitive to touch. So this is for Balanitis. Causes for the Balanitis, like it can be due to some hygiene problem, like if you are not the basic hygiene, you are not following the hygiene steps, and if you are using any deodorizing, highly scented, highly deodorizing soap or cleanser. So just a certain medical condition, like whether it is a reactive arthritis, yes, in that case you can have it. And there are some STDs, sexually transmitted disease, like syphilis, trichomonas, and gonorrhea. In these, yes, you develop Balanitis. And there are some medications like basis antibiotics if you use sleeping pills frequent basis. So these medicines also lead to the Balanitis. Sign or symptom part. What sign or symptom you have? See, this is a kind of inflammation, swelling. So obviously you will be having swelling, inflammation, the part is inflamed, and there is a swelling, redness, you have pain, you have itchiness, and at times there is an abnormal discharge and persistent itching and discomfort you can have. And there is associated foreskin problem. You can have a tight foreskin as a complication or as a symptom. Usually the condition goes on its own, and it is a very common when you apply some ointment, like you apply antifungal ointment cream, then it usually goes off. But if it doesn't goes off, and if it is on the frequent repetitive basis, then cause of concern. And then how we diagnose it, what are the tests required? The condition is usually easily diagnosable by physical examination, by collecting all your symptoms, what symptom you are having. Yes, sir. There is a discharge can be studied, like if you have any fluid discharge, the discharge can be studied whether it is a bacterial infection or the fungal infection, and your treatment completely depend on the type of your mode of treatment. And at times there is a biopsy can be done, rare to rarest cases when you have frequent basis. Prevention part, if you are using highly scented deodorizing cleanser, just avoid that, avoid all the soaps and highly deodorizing any scented items, just avoid that. And if you're not maintaining your hygiene, so just focus on your regular basis hygiene, because when usually in uncircumcised men, and when they are having their foreskin, and there's a space and the space is moist, so usually this becomes a place of infection for bacteria and fungus as well. So you are supposed to clean that particular area with the normal water, with the warm. Homeopathic treatment. See, there are very effective medicine in homeopathy. Completely depend on your case history, on your complete analysis of your case, that is holistic approach, and your individual approach. Mean what symptom are you having, your peculiar, your keynote, your characteristic symptom. So about all the medicine, like this is the Rustox, and Rustox is given. See, these are oral medicine, you don't have to apply on your affected area. These are oral administration, means you are supposed to take it orally. So this is Rustox, and you are supposed to take 1 or 2 drops. See, this is the medicine name, and this is very important. The potency can be lower, medium, or higher. You just start with the lower, like 30 or 200, and the color or the size can vary from company to company or by place to place. Wherever you belong, just focus on the medicine name. Even form of the medicine can be anything, like it can be pills, it can be in mother tincture form. So you just use just focus on the medicine name. Rustox is given when you have dark redness, means you have redness and that is on the darker side, and you are having vascular eruptions are there, so and you are very restless. So in that case, Rustox is given orally, 1 or 2 drops on directly on your tongue, and if you have any problem, you can add some water and you can increase the number of drops. The next Apis mellifica. You must have heard about Apis mellifica. Apis is given in all the inflammatory cases, all the swelling cases. in balanitis as well. So apis is given when there is a redness, there is a inflammation, and there's a burning and a stinging pain. You have feeling like there's an insect bite. You can use apis mellifica. Stinging sensation, you have bee sting like sensation. So in that case, you can use apis mellifica. Again, oral form 1 or 2 drops directly on tongue before meal and after cinnabaris. Cinnabaris is the medicine that is used when you have a balanitis along with phimosis, means you're having tight foreskin issues and you are having inflammatory issues. So in that case, you can use cinnabaris, and there is a excessive itchiness in cinnabaris. So you can use again with the help of dropper, 1 or 2 drops, twice or thrice. The next medicine is Maxol. Maxol is given when you have balanitis associated with other STDs, means this is given in the STDs as well. If you are having any discharge, you are having vascular eruptions, and penile part is very sensitive to touch, in that case you can use Maxol. So these are the oral medicines. Some other medicines also work in the balanitis cases, like caladium also works very effective when you have dryness and you have redness. And there are other medicine like acidum nitricum, rhododendron, thuja. It depends on the complete patient. If you're watching on YouTube, I have provided all the medicines link on the description box. You can buy medicine from there and you can start your treatment. The medicines only available on online homeopathic portal nearest your pharmacy, homeopathic pharmacy or homeopathic store. Now let's talk about the home remedies. See, home remedies are very important part in balanitis. Why? Because balanitis at times goes on its own and at times it doesn't go. So there are very effective home remedies. You can use tea tree oil. Tea tree oil again very effective. It reduces your inflammation, and along that you can add coconut oil. Coconut oil again a very good effective treatment in all the mild or moderate allergy cases. So again this is a very good yogurt. Yogurt is again yogurt usually enhances your healthy bacteria. So it is very good if you are using orally, or even you can apply yogurt on your affected part. So you can use aloe vera gel. You can apply fresh aloe vera gel. You might aware about aloe vera's property like the cooling effect, as well as it is anti-inflammatory. So this reduces your swelling and this gives you relief in your burning, right? And you can add ginger in your diet. Again, ginger very effective, known as anti-inflammatory. And you can add garlic in your diet. Garlic again have property of antifungal as well as antibacterial. So you can use ginger, you can apply coconut oil, you can apply yogurt. Hopefully this video can help you. If you find this video knowledgeable and informative, don't forget to subscribe my channel, press the bell icon to get notified. Thank you for watching. Thank you for your support. Thank you so much.